The curved right and left inserts are traditionally used for periodontal patients. That being said, we talked about the fact that they are utilized in the probe adaptation, or the vertical adaptation. Let's take a look at that again. This is the right insert, and we determined that the right insert, the curvature is going to the right, on tooth number 30 is going to go into the buccal here in a vertical probe approach. But there are other ways to use these inserts instead of just the vertical approach. The vertical approach is more for the periodontal patient, and again, vertical is similar to the probe as far as the approach. But these curved inserts can also be used in a supragingival sense. Let's take a look at this posterior sickle Nevi instrument. And let's look at how similar they are in design. You can see it curves to the left, and you can see this one curves to the left. Let's talk about that as far as how we use the posterior Nevi. We know that it's used under the contacts. It's a sickle, universal. It's going to be used under the contacts like so. This is called a transverse or an oblique approach. Again, we do not use it in the vertical approach. We would not use this for a periodontal patient, but it is an excellent choice in supra. So if we take the left insert and we do that exact same thing, you can see that adaptation is ideal. So if we use the curved insert in the transverse approach, and I like to remember it as toe up, toe transverse, we know that we can use it here on the buccal like so. Then in the transverse toe up approach, it's going to go on the lingual on this side. Let's take that one step further. If we're using it transversely on the buccal, then we know it is the correct insert to use vertically in the periodontal patient. So you can see the bump is against the tooth, and we learned that in the vertical approach for perio, but then we can come across that tooth and use it in the transverse approach. So you can come along the side and use the lateral, but it is mainly used interproximally, just like the Nevi or the posterior sickle. So this is the left insert, transverse, toe up, buccal, come across, and then you have your probe-like periodontal approach. The right insert, we knew that the right one is correct for the perio probe approach here. So therefore we know